Hello class, today I'll be describing a rotator cuff strain, specifically a supraspinatus tear. The mechanism of injury will have to do with an athlete overthrowing and injuring themselves during the deceleration phase. To begin rehabilitation, they first have to follow the rule PRICE, which is immediate care for such an injury. That'll involve protection, rest, ice, compression, elevation. Once that's done, they'll be getting surgery as soon as possible due to it being a rotator cuff tear. That could be very serious. Once they're relieved from the surgery, the wound itself, where the surgery was taking place, will take days to heal around there. And then, although the tendon was repaired during the surgery, the athlete will still have to wait a few weeks until they can fully function or even start with minimal stretches. Once the tendon has repaired successfully, they'll be able to complete their stretches. And from there on, that's where we begin, phase 1. So the beginning of the rehabilitation program, which is phase 1, is regaining their active range of motion. Our goal for this is for them to be able to hit phase 2 with complete range of motion of their tendon and mainly the rotator cuff. Once they feel comfortable, they'll be able to move on to phase 2. But to move on to phase 2, they first have to start off with exercises that they'll be prescribed and followed for a certain amount of weeks until, of course, they feel fine. The following 10 stretches will be prescribed to the athlete. They'll be done 4 to 5 days a week. They'll be done with 3 sets and a 30-second hold each repetition. A rest of a minute will be taken in between each set. And first, we're going to start with pendulums. Pendulums will be involving either both arms, if you want, to not cause imbalances, or the affected arm will be laying on a table, any flat surface really. You're going to be stretching the lat around there like that. The second could be an active assisted range of motion with a stick, either going into abduction, holding a stick like this, stretching it out, and then going back down with abduction. That's an example. A towel stretch would involve internal rotation with shoulder extension, stretching out those front delts. All those muscles right there would be getting a good stretch. It would be performed like this, holding the towel behind your back. A sleeper stretch would involve yourself laying down, obviously on a bed, comfortably with your arm like this, stretching all these muscles. And then they could either do horizontal abduction or adduction, involving this against the wall. They can either place their hand up here in the middle or lower, depending. They could go all the way, preferably to stretch everything out. Or they could go into adduction, like this, same thing, stretching it out. After that, they can also perform a doorway stretch, which involves really just both arms laying on the barriers of a door, and then your pectoralis just going forward, stretching out those fibers. And then the next thing you could do is involve a foam roller, a pec stretch. It would be like this. A foam roller would be right here. Basically, it'll be rolling against your chest. Or if you want, you could also place a foam roller on your lat and stretch the lat. Another thing, which is personally one of my favorites and will be involved in this, is going to be a resistance band stretch, where you can use a band, hook it onto any barrier, any steel, anything that holds it. You can hold onto it either like this, stretching out the shoulder and your chest, all the muscles right here. Or you could also turn around like this, going into heavy adduction, preferably. But yeah, that will conclude phase 1 for the acute injury, and we move on to phase 2, and that's it.
Hello class, my name is Jose Gonzalez, and for our kinesiology project we did rotator cuff strain and impingement syndrome. I'll be focusing on phase 2, the repair. The goals for this would be to alter joint biomechanics to reduce the likelihood of impingement, and this usually lasts about 2 weeks. Therapy would be continuing using electrical stimulation and ice to moderate pain. Ultrasound is also helpful in reducing inflammation. Continue anti-inflammatory medication as well. So for the rotator cuff rehab, uh, proper therapy exercises are important recovery for most therapeutic conditions. I'll be providing you with up-to-date therapy regimens you can access at home or at the gym, and best of luck to you in your recovery. Phase 2, so active range of motion and gentle stretching. Key points would be no internal rotation behind back for first 8 weeks. No shoulder motion. You can start with table, slides, progress to pulleys or stick, and then finally active motion. You must regain full motion by the end of phase 2. Stretching exercises at 10 weeks if deficient. Isometrics are okay to start at 10 weeks. And I'll go ahead and start with the strength enhancing exercises. So you're supposed to perform three times per week using the schedule of sets and repetitions. So it'd be 3 by 10 and then take a day off. The next day would be 3 by 15, a day off, and the next day 3 by 20 and then a day off. So that'd be the whole week. Complete range of motion stretching exercises prior to and following strengthening exercises. So the first one would be active flexion. So I'll just explain it. Stand with elbow straight and thumb facing forward. Raise involved arm upward in front of body as high as tolerable. Hold and slowly lower. Repeat as directed. Second one, active abduction. Stand with elbow straight and thumb pointing out. Raise involved arm outward to side of body as high as tolerable. Hold, then slowly lower to start. Repeat as directed. Another one would be prone extension. Lie prone on stomach with involved arm hanging floor. Rotate arm and thumb outward as far as possible. Raise arm toward hip. Do not raise higher than parallel to the floor. Hold, then slowly lower to start and repeat as directed. Prone horizontal abduction. Lie prone on table. Rotate arm and thumb outward as far as possible. Raise arm out to the side. Do not raise higher than parallel to the floor. Hold slowly and return to start and repeat as directed. Sabine internal and external rotation. So this would be lie supine on the table or floor with shoulder abducted to 90 degrees with arms supported on table and elbow flexed. Slowly raise hand up and forward as far as possible. Hold for a 1 to 2 second count and slowly return to start. Attempt to place back of hand on table in up position and palm on table in down position, and repeat as directed. Supine triceps extension, lying flat on back with involved elbow bent near head. Rest involved hand on uninvolved shoulder. Slowly extend elbow as straight as possible without moving upper arm. Slowly return to start and repeat as directed. Supine press, lie on back with elbows next to chest and flex to 90 degrees. Slowly raise and extend arm straight forward. Hold, then slowly return to start and repeat as directed. Seated dips. So sit on the edge of a table or chair, gripping sides of tables with hands. So slowly straighten arms, lifting your butt off of the seat. Hold for 3 to 5 seconds and slowly lower to the table and repeat as directed. The towel squeeze. So you fold the towel into eighths and place between the chest and involved elbow. Slowly squeeze arm against towel and chest with forearm crossing in front of body at 45 degrees angle. Hold isometric contraction for 5 to 10 seconds and relax. Repeat as directed. Then do shoulder shrugs. So those are pretty self-explanatory. But standing with arms at sides, lift shoulders up toward ears and hold. Then pull shoulders back, pinching shoulder blades together. And hold and relax and repeat as directed. Bicep curls. So that's pretty much self-explanatory too. Just in a slower and gentle um, form. Okay, okay. And here's another list that I was able to make myself. So, if your motion is more limited, you can put your arm on the table and gently slide your hand out along the table and gently stretch out your shoulder. This can be done with your arm facing forward. Lean into the stretch and hold it for 20 to 30 seconds and loose up the shoulder joint. The towel is helpful to allow you to slide as you lean into the stretch. So while you're doing this, this would just be a slow motion as well, as all of these exercises are. And that one I would just call it a table slides elevation. Another one would be upright stick elevation. So your shoulders should be leveled, and you could also do it out to the side, and that would be into abduction. So while you're doing that, you're just doing it slowly and not too hard, so you don't re-injure yourself. The upright stick external rotation at 0 degrees, so that'd be forward and side to side, uh, the same speed. You're still doing it slowly. Uh, so all these are targeting muscles around the shoulder blade. So you're just pinching the shoulder blades together and holding for a few seconds for these last two, the stick ones, and yeah, you'll be able to feel it uh, doing what it's supposed to do. Another one would be tabletop protraction. So your hand is stabilized at the table, uh, rotating the torso further, feeling your shoulder blade rotating forward on your rib cage, and that's activating the muscles around your shoulder blade, and holding for a 2 to 3 count. Um, and you're pulling your shoulder girdle back and forth. So yeah, it's the same slow motion as well. So stretching internal rotation with stick or towel. So that would be behind your back, and you're just going up and down, but slowly, and just trying to stretch out those muscles right there around the shoulder. Um, and you're just doing this to increase internal rotation since it's behind your back. And the last one would be isometric forward elevation. So you're pushing up against the wall gently, but at the same time you're activating the muscles around the shoulder in different positions. And also this could be done out to the side in abduction. Um, so rotation against the wall helps strengthen and external rotation as well. So you can either do it to the side or just have like your wrist pushing against the wall, and that's doing the same thing for this phase of repair. And yep, that's it. Thank you for your time.
All right, so my phase is phase three. So for phase three, I have 6 exercises. The T-band ER with the IR with towel, standing row, supine punch, sideline ER, PNF diagonals, prone mid, and low traps. And then for the goals for phase three are to return to unrestricted activity. During the functional phase, exercises which are more sport specific are introduced in preparation for returning to full training and competition. Phase three aims to increase power and endurance in the upper body muscles, improve strength of the shoulder joint in all directions, and introduce sport specific shoulder injuries. Phase three, increasing power. This is done through more plyometric or explosive type exercises. It may depend on your particular sport. Diagonal sport-specific exercises using exercise bands can be done. Throwing and catching type exercises with mini medicine balls can be done. Racket sport players may begin to work with more racket and balls, but with the emphasis on strengthening the weak muscles rather than full sports training. For example, throwers would throw, excuse me, would start throwing a tennis ball against a wall in 5 sets of 20. when he throws, gradually increasing the number of sets and number of repetitions, assuming no pain during activity after or the next day. Therapy. Use ultrasound before the workout and ice after completing the workout and continue anti-inflammatory medication. All right, so right now I'm showing a presentation of the T-band ER with the towel. Now I'm showing a example of the upright row. I don't have weights at home, so I'm just gonna use a towel. Supine punch exercise. Now, like again, I don't have weights. Of the side lane ER. Example of the PNF diagonal patterns. Superman.
Phase 4's main goals are a full return to sport while preventing re-injury by increasing strength, endurance, power, and neuromuscular control. Many of the exercises discussed in phases 1 through 3 can be continued at the same rate of training prescribed earlier to promote full range of motion achievement. During this phase, however, we can now add different modalities of resistance to assist the athlete in building back the shoulder strength. In overhand training athletes, programs involving plyometric weighted balls and weighted baseballs and softballs can be utilized over an extended duration of time. These programs typically run anywhere from 6 to 8 weeks. During these programs, the athletes are asked to throw 3 times a week while making sure they get ample rest on the prescribed rest days. These programs are intended to initially build up the strength of the posterior chain by training the eccentric motion during movement patterns. Many professional organizations are now using these programs on their athletes as well. The most notable program offered is from Driveline Baseball, which uses weighted plyo balls ranging from 100 grams to 2 kilograms in order to help build posterior chain strength, and also uses weighted baseballs during throwing practice to promote arm strength and efficiency. Exercises included in the rehab portion of the Driveline program include reverse throws, which call for the athlete to get on their throwing side knee, and with a stacked torso, the athlete creates some momentum forward and drives the shoulder and elbow back, propelling the weighted plyo ball into the wall behind them. Another exercise is the upward toss, which has the athlete hold the plyo ball in their throwing hand with the arm out to the side. The next step is the athlete throws the ball up and catches it with the same hand as it begins to fall, like so. The band pull-apart circuit, which includes the athlete going across the chest, 2 different diagonal directions, and once behind the head. Each direction has 15 to 20 reps, and all of the movements outside of the behind the head should be done with straight arms. Finally, the side-lying external rotation with a toss. This calls for the athlete to lie on their non-throwing side, and with the throwing hand, hold the plyometric ball with the throwing elbow resting on the rib cage. The movement is essentially the same as the upward toss, just from a different angle. As you throw it up, you catch it as it's falling back down. These exercises all work the posterior chain by focusing on the eccentric movement in the throwing motion. It is important to strengthen the posterior chain because it essentially acts as the braking mechanism for the shoulder when throwing overhead. The next step and final phase 4 is to ingrain new patterns. This can be done by using the weighted baseballs and weighted softballs offered in the Driveline program. These weighted baseballs are designed to maximize efficiency in the thrower's motion while also promoting arm strength. The program calls for the athlete to use these weighted baseballs and softballs during throwing practice to help maximize intent towards building arm speed. By building up the arm speed, we are also incorporating power and endurance into the training with the weighted balls. All of these motions and exercises are sport specific to overhead throwers and can be used in the final phases of their recovery.